data in 2013, which we hope will show us similar gains in those areas. So to be able to make the argument that yes, prevention's effective, yes, we need treatment and we need recovery, we need everything working together, as a unit, but that prevention's a big piece of this as well.
Doctor, you and I talked about recovery in the sense of what states are really actively involved in. Massachusetts, we're very lucky to live in Massachusetts because we've been progressive in the recovery area. I mean, we have schools, don't we? High schools.
Yeah, recovery high schools.
Yeah, it's so rare.
Yeah, and I think, the investment in recovery infrastructure, recovery support services has been very important nationally and at the state level with recovery schools. I'm involved nationally in the Collegiate Recovery Initiative, which is implementing recovery support services in college settings, which we know are higher risk settings, so that people who get into recovery from addiction can go back to college in a safe and supported way so that they can get an education which can help support their recovery and also, support their lives and also be productive citizens, because if people are back in the workforce, they're paying taxes, and that's good for the economy as well. So as what we're talking about, cost and cost effectiveness, we know that every $1 invested in treatment results in $12 of cost savings to society overall in terms of productivity, lost productivity, and criminal justice and healthcare costs. So just $1 invested in treatment gives a 12-fold payback.
So why aren't we doing it? What's wrong with these politicians? They don't see this.
Part of the problem is who's paying for treatment and then who reaps the benefits.
Yes.
You see, there's a disconnect there. So somebody is paying for treatment over here, and they're getting more people into recovery and decreasing the harm to public health and to criminal justice and increasing productivity. But these guys over here are benefiting, but they're not paying the bill over here. So there's a disconnect, even though overall, like I said, it's a 1 to 12 ratio.
It's not an
of
instant
benefit.
gratification.
It's not. The people who are benefiting aren't always all the ones who are paying for it, unfortunately. So we need to do a better job of connecting the costs across these different systems at the state level and federal level so that we can start to really incentivize communities, incentivize states that this is good. Now, they have done this in other states, if we can talk about other states.
Yes,
here.
of course.
But Connecticut, for example, has been a leader in this area. They spend 10 times more than nearly every other state on prevention and intervention and treatment.
Marvelous, yeah.
They've done a great job in really leading the nation in terms of creating a model of transformation from disintegrated services to one of a recovery-oriented community and recovery-oriented system of care. What they've done is actually improve recovery rates and decrease costs at the same time. Right. So that's the way that we should all be moving. Now, nationally, we spend, of every dollar spent in this area of addiction, as I mentioned, $750 billion every year that is spent in terms of the burden from substance use disorders and related problems. The majority of the 99% of that is sweeping up the wreckage of the impact, the negative impact from substance use. Only one cent in every dollar, roughly, or $1 in every $100 is actually spent in treatment and prevention. So we've kind of got that. We've got that backwards. Like I said, Connecticut spends $10 out of every $100 on prevention and treatment, right? Which is still not a lot, but 10 times more than any other state. So. So it's a matter of kind of thinking this through and getting people together to realize this, and they've done that in Connecticut. So we know it can be done. It takes a lot of effort, concerted effort by a lot of people to make it happen, but we know it's possible, and that's the good news.
Georgia also. Wasn't Georgia doing some things, or was that just on the prescription drugs? Wasn't Georgia one of the first to come out with a program where you had to check in doctor shopping and all of that? I might be wrong. I remember being very surprised that it was a southern state.
Kentucky?
Maybe.
I'm not really sure.
Might have even been Connecticut for all I know. Jessica, drug and alcohol abuse is a huge societal issue. And what's very interesting of alcohol versus the pills and opiate abuse is you go out to dinner and you may have some wine or whatever. It's very social. You're not going to pull out a pill and say, okay, let's split this up, guys,
Right.
in the middle of a restaurant.
Absolutely.
So I don't know, will it ever get that way? It's bigger than Weymouth and even bigger than the South Shore. Every community is dealing with it. Are the communities dealing with it in different ways? Shouldn't we all come together, get regional, and fight it as a force?
It's a great question, and I think there are movements toward regional efforts, for sure. I think I get to work with coalitions like the Substance Abuse Prevention Team across the state, and I'm very aware of the work across the country that's going on, and every community is dealing with substance abuse issues in different ways, and they express themselves differently. So for me, I think regional work is very important, but also to make sure we don't lose a local perspective, because only we know, if we're in Weymouth, what the local conditions are that are very specific to
Yes,
Weymouth, and we want to make
yes.
sure that we're responding to those influences. You think of the young people getting messages from their peers and their friends on
Yeah.
Facebook and Twitter, their parents maybe having a drink with dinner, and other trusted adults, the messages you see on TV, in the media, in magazines. And from the prevention perspective, we're looking to address all of these influences and dispel misperceptions about what is the norm around young people using substances. So, because it's not the norm. Most young people don't drink. Most young people don't use other drugs and substances. And when they know that they're part of that majority, it can be very protective. And so there are strategies to make that known that can be applied throughout regions. And I know Weymouth works really closely with communities nearby on specifically prescription drug abuse, I think, with
Yes.
Quincy and other neighboring areas, because you can apply these strategies and interventions across borders, and it can be really cost effective to do it that way as well.
And as you know, we just we partnered with Braintree, Quincy, Randolph, and Stoughton, and we're receiving some regional dollars for opioid
And God love Quincy.
use.
Quincy has
Yeah.
done so much to lead the way on the South Shore.
Yep.
They were the first. They put themselves out there. They were.
And we've been working with them all along for the past, since I've been here over 7 years and going on 8 years. And we've been working together, and we learn from each other.
Yes.
This all affects us all, and we
Sure.
can learn from each other. Quincy was the community that gave us the kiosk for
Yes.
the medication collection kiosk for the police station.
It's been wonderful.
That was one of the first things that they helped
Isn't
us
it
out with.
interesting that you can get people alarmed if you talk about Lyme disease? Everybody's, watch out for the ticks. And everybody, they buy it. Okay, yeah, we have to really watch out. Or flu. Oh, it's a flu epidemic. Everybody's going to freak out, get the shot. But we can't get them to embrace this issue. And it's so much bigger. I don't understand why.
I feel like, from my perspective, there is something around the norms that are passed along generations, and rites of passage certainly, and just permissiveness and not approval but acceptance from adults. I think there's a lot of different prevention efforts, but one of the strongest protective factors is really having this family unit that has a clear message around young people using substances, and making sure that you're consistent across the board on that. Would you agree?
I absolutely agree with that.
And I think one of the things is that there's nothing pleasurable about it getting Lyme disease, and nothing pleasurable
No.
about
Right.
getting the flu.
Okay,
But there
yeah,
is
big
something
difference.
pleasurable. Yeah, so this is the rub, you see, and it's related to the pleasure, but it's also related to the beliefs about harm. So people, if you talk about Lyme disease and influenza, then people say, well, there's nothing pleasurable about that, and I'm going to feel sick if I get it.
Yeah.
Now, if you talk about addiction, people say, well, that's not going to happen to me.
Yes.
As Jessica was saying,
Exactly.
it's very important that we get the message out that yes, it could happen to you, and these are the consequences, and having people exposed to people who've been there and done it and had the suffering that's associated with that connection needs to be made more strongly. Is that because people have the belief that when they take an OxyContin pill or an opiate that's from a friend, they say, well, this is safe because it was prescribed once. They take it and they think, well, this is not going to happen to me. And families think, this isn't going to happen to our family. This is never going to happen to my family. And then they find themselves in that hole and they can't get out of it. And then the shame prevents them from seeking help earlier.
Yes, yes.
Or they minimize it. They don't want to look at it. They don't want to believe that it's actually happening to their family.
So it really is
And
very
I see
difficult.
that even when I'm out in the, we do the Great Pumpkin Giveaway, and I walk around sometimes with literature, and, young families are there. We do face painting, we get involved, and then we try to give the literature to families, and I don't need that. That's not going to happen to us.
Yeah.
And I think that's a really good take-home message, that it can happen to anyone.
Yeah. Jessica, when you, what does prevention work look like in Weymouth? Are we doing good stuff here?
I think you guys are doing great stuff, and Lynn, you should help me with this. I've started working with the substance abuse prevention team 2 years ago, and this group has been funded federally by the Drug-Free Communities Support Program grant twice. It's a highly competitive grant. Something like nearly 500 communities across the country applied for the last iteration of the grant, and only 78 were funded, I believe.
87.
because I'm dyslexic.
452 applications
452.
were reviewed in 87 communities, and we were one of them.
That's right.
Yes, we were very lucky.
And through that grant, Weymouth, the substance abuse prevention team members have gotten extensive training about what works in prevention. There are things that actually we know to be effective. They're evidence-based, and if we do them, we can expect to see an outcome, and that's what we're doing here. And we are seeing those outcomes. I shared some of those numbers a little earlier, but what we're really doing is using environmental strategies, so creating policies that are effective in preventing access to substances, and then making sure they're enforced, educating the community, like Dr. Kelly's saying, and also increasing our collaboration and communication across the different sectors of the community. So this group, we need parents, youth, healthcare providers, law enforcement, media, elder services, faith community business. That's 8 of the 12 sectors. I usually can get like 9 or 10. But we try to get everybody together, everyone on the same page with the same message, all defining what type of community they want to make Weymouth become. And having that participation and having the active voice of the community has been really effective in making those change and preventing it.
Absolutely, I totally agree. And we have, I'm so proud of the people in this community. I live in this community, and I'm proud of the people who come to the table and who really do a phenomenal job. There are nights when we meet. We meet, by the way, on the first Monday of every month from 6 to 8 p.m. at the Weymouth Teen Center, located at 1393 Pleasant Street.
Anyone who might have interest.
Anyone who might have interest.
Come on down.
But we've had, we're very lucky. We've had up to 30 people in the room. We work on some really serious issues, and we really incorporate the strategies that are necessary to combat this problem. So,
30 people in the room, but countless other
countless
partners.
other partners in the community
That can't get there maybe on a Monday night, but that have been helping with other initiatives.
that help with other initiatives.
Sure.
That includes the police, the district attorney, it includes parents, Learn to Cope support groups, the firefighters. Kudos to the firefighters who are now
Yes.
carrying the nasal Narcan here
I
in
was
Weymouth.
so thrilled when
Huge,
they brought that up.
huge.
It's big. It's very big.
Yeah.
But it's important for Weymouth to know. I have some people say, you're really overkilling this whole drug issue. So no, we've saved lives.
Absolutely.
Because it won't go away, and
Right.
people will die.
Yes.
So if we're saving some lives, it's worth any stigma
That's right.
attached.
And
Any-
like Dr. Kelly said, it takes an average of 8, it takes a long time. So if we can, we want to prevent it, we want to stop young people from using to prevent addiction, but for the people that are, currently suffering of addiction, we are helping them. We are getting word out that there are support groups out there. We are getting word, we have the nasal Narcan on the trucks, and I know that the firefighters, I believe they started carrying the Narcan March 1st of 2013, and in the first month they had 13 saves. That
people
really...
who would have died. It's
Yeah,
amazing.
people who could have died.
And it's important for our residents to know that these are important stats. The lifetime use of alcohol went from 53.8% in 2007 to 46.1% in 2011. That's huge. That's a huge drop.
That's with students.
With students, okay?
Yep,
And the
students
30-day use of alcohol, 30-day use of alcohol went from 32.5 in 2007 to 27% in 2001. Again, students. But still, this is the people who are going to be coming up and abusing.
Right.
Lifetime use of cigarettes went from 29% in 2007 to 20% in 2011.
Right.
The 30-day use of prescription drugs without a prescription has decreased from 3.6% in 2007 to 3.1% in 2011. That might not seem
It's
like
small,
much,
but
it's a movement, and it's
Right.
and
And when you
it's
think
slowing.
about how many kids we have that are being, there are a couple of thousand kids that are being that are participating in these surveys. So a small percentage is still a lot of kids.
And when you think about like how mammoth these movements actually are, I mean, each of these percentage points, like 0.1% are kids, are human
Huge,
beings.
that's right.
I mean, it took us 6 years, it'll take us, when we do the next collection of the survey, it'll be 6 years since 2007, and we'll be able to see over time, but it takes a tremendous amount of time. So, I mean, I feel like if you were to spill something, you wipe it up, right? You see the effort and you see the result. Your countertop is clean. With prevention, it's subtle. It's not as obvious. You'll see these numbers going down slowly over time. There'll be less hospitalizations, maybe less ER visits for substance-related issues in youth. You know, fewer kids will start using, and the age that they start using will be older, potentially. And these are the types of gains that we hope to see
Right.
in prevention.
And we need to stay on it too, and we really need to look at the data constantly.
Yes.
And if we don't stay on it, with this grant goes away and we don't stay on it, we're not going to see the trends. We're not going to know what types of, we're not going to know what the drugs of choice are out there. Like, who knew heroin was going to be the drug of choice?
Exactly.
So we really need to keep up
And the message
with
here
that.
is that we have a horrific epidemic, but it's working. Our efforts are working.
Yes.
And that's what people need to understand. We're moving forward, and there have been results. We've run out of time. Doctor, thank you so much for coming.
pleasure.
Jessica, I appreciate you being here. And Lynn, thank you so much.
Thank you very much,
I
Mary Kay.
appreciate it. Thanks again.